So welcome. In this session, we'll be looking at cranial meninges. And give me a minute. Under cranial meninges, by the end of this session, you should know the pia mater, okay, arachnoid matter, and more so importantly, the dura mater and the neurovascular supply of the dura mater. Welcome all. My name is Wallace Munyeri, and I'm the Daktari. So, cranial, let's start with an introduction. Now, the interior of the cranium is usually lined with dura mater, okay, which is also known as Meninges, okay. Then the surface of the brain is covered with pia mater, okay. Then between the dura mater and the pia mater, and in contact with the pia mater is the arachnoid matter, okay, which is connected to the pia mater by fine filamentous processes known as hence those filamentous processes make that matter to look like somehow a spider. That is why the term arachnoid, okay? Then these three tissues, that is the dura mater, arachnoid matter, and the pia mater, they form the cranial meninges, okay? Now, the cranial meninges described here are usually continuous with the spinal cord, the meninges around the spinal cord, the spinal meninges, okay? But you will see there are some differences between the cranial dura mater and the spinal dura mater. Now, the dura mater is mesodermal in origin, where the arachnoid matter and the pia mater, they are from neurocrest origin. And that's why arachnoid matter and the pia mater are collectively known as leptomeninges, okay? So here is a diagram. So you can see this is the dura mater. This is the dura mater here. Then beneath it is the arachnoid matter. Then lining the surface of the brain here, it is there. So this is the arachnoid matter. Then lining the surface of the brain here is the pia mater. Okay. So, and you can see here, maybe, but just to know that the dura mater in the cranium has two layers, outer endosteal and an inner meningeal layer. Okay. But in the spinal cord, it does not have two layers. It's a single layered. So that is just one difference between the spinal dura mater and the cranial dura mater. Now, pia mater. The pia mater usually invests the brain and the spinal cord, just as the periosteum usually invests a bone, okay? And it contains blood vessels, and nowhere does any structure intervene between pia mater and the underlying nervous tissue. Okay, so it is continuous with the nervous tissue, that is with the brain. Now, it usually closely invests the surface of the central nervous system, even into the depths of the deepest fissures and sarsi. It will enter there, okay? It is made of thin vascular fibrous tissue and can be stripped away from the brain, okay? It is usually prolonged. It is prolonged out over as the cranial nerves emerge from the brain, it is prolonged out and over the cranial nerves and spinal nerve roots. Then it usually fuses with the epineurium of these nerves, okay? Then it is invaginated into the substance of the brain by intervening cerebral arteries. So as the cerebral arteries gain entrance into the brain, they will, as they invaginate into the substance of the brain, so will the pia mater. The arteries lie close to this sheath of pia, surrounded by a narrow perivascular space, which usually contain cerebrospinal fluid. Okay. I will show you that the cerebrospinal fluid is found in the subarachnoid space. Now, the region between the pia and the arachnoid matter is the subarachnoid space, which is filled with CSF. Now, arachnoid matter and subarachnoid space. Maybe I should go back and show you the pia matter, how I'm studying you. You can see here, even into the sarsi of the brain, you can see they also invests those sarsi, okay? And you can see as the blood vessel here is gaining entry, you can see it is also lined by the pia mater. So it is in continuous with the nervous tissue everywhere, but it can be stripped off. Okay. Now, the arachnoid matter consists of an impermeable delicate membrane that everywhere is usually supported by the inner surface of the inner layer of the dura mater, with only a thin film of tissue between the two. Okay, so if you have let's say if you have dura mater here, this is the inner layer of the dura mater. So the arachnoid matter will be there with a very thin film of tissue intervening between those two. Where was I? Okay. Vessels and nerves usually pierce the dura and arachnoid matter both at the same place. Then they close the subdural space, but they cannot run between these two membranes. So you cannot find a blood vessel running between the dura mater and the arachnoid matter. Okay. But in certain areas, the arachnoid matter usually herniate through little holes into the dura mater into the venous sinuses. At some places, you'll find that this dura mater will gain access to the venous sinuses and make some holes through the inner layer of the dura mater. Such hernia are the arachnoid villi, and through the walls of the arachnoid villi, CSF usually ooze out into the blood. Okay. The arachnoid villi are numerous in the superior sagittal sinus, and its lateral projecting blood rates, which are known as the venous lacuna. I will show you. In the child, the villi are usually discrete, but as one ages, they become aggregated into visible clamps, known as those villi now usually clamp together to form the arachnoid granulations, also known as the Pacchionian bodies. Okay, and they usually leave indentations in the inner table of the cranial vault. Okay, which are found mainly alongside the superior sagittal sinus at the site of the venous lacuna of the blood legs. You can see here, this is the arachnoid matter. But you can see at some places it is piercing this is the dura mater inner layer. You can see it is piercing to form the arachnoid villi, which will as one ages, they usually aggregate to form these arachnoid granulations, also known as the Pacchionian bodies. Okay, and you can see at some places we have this venous lacuna of Trollard. Okay, these are the venous leaks or the blood leaks, and they are found mainly along alongside the superior sagittal sinus. Okay, and you can see this arachnoid villi granulation, can indent the skull to form the granular foveola. Okay, the granular foveola, an indentation of the skull by the arachnoid granulation. Okay, and you can see the filamentous appearance. Okay, that is why it has a spider-like appearance under the name arachnoid matter. Now, subarachnoid cisterns. Now, between the base of the brain and the base of the skull, we can have larger spaces may exist, and those spaces are filled with cerebrospinal fluid, and they are known as the subarachnoid cisterns. These are the main one. Cisterna magna, also known as the cerebromedullary cistern. It is the largest. It usually occupies the angle between the undersurface of the cerebellum and the posterior surface of the medulla. Cerebrospinal fluid flows into this cistern via the foramen of Magendai, okay, in the roof of the fourth ventricle. Then the lateral part of this cisterna usually contain the vertebral artery and the posterior inferior cerebellar branch, okay, on each side. Then the cisterna magna can be tapped in the midline by a needle passed above the posterior arch of the atlas through the posterior atlanto-occipital membrane and the spinal dura. Okay, if one wants to draw the CSF, maybe say you want to test for to see if one has a viral infection, and the virus is found in the CSF. If if you don't do a lumbar puncture, you will see where you do a lumbar puncture between, I think, was between L4 and L5, somewhere there. If that area is not accessible, you can also use this cerebromedullary system to draw your cerebrospinal fluid. But this comes as a second option. The main area to draw CSF is the lumbar system through a lumbar puncture. The pontine system usually lie between the clevers in front of the pons and medulla. Cerebrospinal fluid flows into this system from the foramen of Ruschka, that is from the fourth ventricle. The system contains the basilar artery, pontine and labyrinthine branches of the basilar artery, and also contains the 5th to the 12th cranial nerves, which emerge from the brainstem. Interpuduncular system, this is a very important one, especially its boundaries. I urge you to go and look at its boundaries and contents. Okay. Then we also have the chiasmatic system, which lies above the optic chiasma, beneath the rostrum of the corpus callosum. It usually contains the anterior communicating artery. Okay. So here we are. This is a cisterna magna. You can see CSF from the fourth ventricle accesses the cisterna magna via the midline aperture of magenta. Okay. Then here we have your pontine system or your prepontine system. Fluid will flow from the fourth ventricle via a foramen here, foramen of Ruschka. Here it is into the pontine system. Then here we will have a very important system here, the interpuduncular system. Please go and know the boundaries. It is diamond shaped, not a diamond. It has, because it has like how many boundaries? 1, 2, 3, 4. It has 6 boundaries. Okay. Then you have your chiasmatic system here. Okay. Then you also have another system here known as the quadrigeminal system, which contains the great cerebral vein of Garen. Okay. So dura mater means this will take most of the lesson. Now, the dura mater in the cranium usually consists of 2 layers, outer endosteo, inner meningeo. Now, the 2 layers are usually firmly adherent to each other, except where they split to enclose the venous sinuses, or where the inner layer is folded to form the dural folds or the dura septa. Okay. Now, the endosteo layer is attached to the inner surface of the cranial bones, and it is continuous through the sutures and around the margins of the foramina with the periosteum of the external surface of the cranium. When you did the scalp, you see that P is periosteum. Now, this periosteum is continuous with the endosteum via the sutures, through the sutures, and also through the margins of the foramina. Now, the cranial dura is firmly adherent to the base of the vault, to the base of the skull than on the cranial vault. Hence, it is usually torn. It is usually torn in fractures at the skull base. Okay, and I want you to go and look at one of the diseases associated with the fracture of the base of the skull, known as the Bartos sign. Okay, go and look at that. It also forms part of the wall of the basal venous sinuses. Hence, fractures to the base of the skull are usually associated with bleeding from the ears, nose, and also bleeding to the pharynx. Okay, so one can have a fracture to the base of the skull, and you see them vomiting blood because it has leaked into the pharynx. Now, cerebral dura is stripped off. Cerebral dura is stripped off from the cranial vault when an extradural hematoma is formed between the bone and the dura. Now, the veins, blood vessels can have blood vessels which lie between the bone and the outer endosteal. Okay, if those blood vessels are injured and they bleed, causing an extradural hematoma, the outer endosteal layer will be stripped off from the cranial vault. Okay. Now, the meningeal layer of the dura is strong fibrous membrane and becomes continuous with the spinal dura. And see, only the inner meningeria is continuous with the spinal dura at the foramen magnum. Okay, it usually ensheathes the cranial nerves in their osseous foramina and fuses externally with the epineurum. Okay, it sheathes the optic nerve. It usually sheathes the optic nerve and usually fuses with the sclera. The sclera is the white part of the eye. So you can see how it is usually extended along the optic nerve. Okay, so note that the meningeria is the one which now forms the spinal dura, but the endostelia does not form the spinal dura. Okay, now the inner meningeria, I said it forms, it gets enfolded in certain lines to form septa, which or folds between parts of the brain. We will discuss four main dural folds or septa, namely falx cerebri, falx cerebelli, tentorium cerebelli, and diaphragma cera. Okay, falx mean it is the Latin for a sickle. You know, the sickle which you use to harvest wheat. They look somehow like this, and you will see why also them they are called falx. Then tentorium attent, diaphragma is just the diaphragm. Okay, so what are the functions of this dural septa? They usually divide the cranial cavity into compartments. They usually divide the cranial cavity into compartments to separate the different parts of the brain. By doing so, they will restrict movements of the brain within the cranial cavity. You don't want that every time you are, say, hit at the back of your head, your brain is displaced anteroposteriorly. Or when you are hit at the side of the head, your brain is displaced laterally. You don't want that. Which would, if that would occur, it would lead to tear of the bridging veins. The bridging veins in the subarachnoid space, leading to subarachnoid hematomas. Okay. They also enclose intracranial durovenous sinuses. You look at durovenous sinuses another time. So let's start with falx cerebri. It is a large sickle-shaped vertical fold of dura mater which usually dips into the longitudinal fissure between the two cerebral hemispheres. Then it is narrow anterior. At the anterior end, it is narrow, and it is attached to the crista galli, part of the ethmoid bone, and it is broader posteriorly, and it is attached to the upper surface of the tentorium cerebelli. Then its convex upper border usually house the superior sagittal sinus. But let's first discuss this. The convex upper border is attached to the vault of the skull along the sagittal suture, and the lower border, it has an upper attached border and a lower free border, which is concave. Okay. Then the falx cerebri encloses three durovenous sinuses: the superior sagittal along its upper attached border, inferior sagittal along its lower free border, and the straight sinus along the line of attachment to the tentorium cerebelli. Okay, let me show you that in this very good diagram here. Here, this, you can see, this is the lower free border. This is where you find your inferior sagittal sinus. Then here, it is attached to the along the sagittal suture. That is where your superior sagittal sinus is found. Then this is a tentorium cerebelli. Then you can see here they are attached. That is where the straight sinus will be. Let me take a pen and make your life easy. So here is where here is where the inferior sagittal sinus will be. Then it will come and confluence with another vein known as the great cerebral vein of Garen and form the straight sinus, which will move along here, along the line of attachment of the falx cerebri to the tentorium cerebelli, okay? And they will move towards the confluence of sinuses here. Now, tentorium cerebelli, it is like a tent-like semi-lunar fold of dura mater, which forms a sloping roof of the posterior cranial fossa, lying between cerebellum, which is inferior to it, and the occipital lobes of the cerebral hemispheres superior to it. Now, it usually prevents the cerebellum from being compressed by the occipital lobe of the cerebrum. Now, it has two borders, an outer convex attached border and an inner concave free border. Now, the inner border passes usually bound an oval space known as the tentorial notch or the door of the tentorium, through which the midbrain usually pass to connect the hindbrain from with the forebrain. Okay, then on each side, that is on each side along the outer attached border, the anterior half of the outer border is attached anterolaterally to the superior border of the petrous temporal bone and the posterior crinoid process. Then the posterior half is attached posterolaterally to the lips of the transverse sulcus, and that is where they will house the transverse sinus. Okay, then the inner free U-shaped and its anterior end are usually attached to the anterior crinoid process. I will show you that in a diagram. It usually contains 4 dural sinuses, 2 on either side. That is superior petrosal sinus along the anterior half of its attached border. It is attached along the superior border of the petrous temporal bone. That is where the superior petrosal sinus will be found. And also the transverse sinus along the posterior half of its attached border. Okay. And here we are. So this is the anterior crinoid process. Then you can see it will be attached like this. Here we cut it. So that is the free border, inner free border attached to the anterior crinoid process. Then the outer attached border is attached along like that, then along this line here, attached here, and also here. Okay, so this is the anterolateral here, and this is posterolateral. Now you can see anterolateral is attached here to the superior border of the superior petrous temporal bone here, along the superior border of the petrous temporal bone, and here you have your superior sagittal sinus. Then posterolateral is attached to the lips of the transverse sulcus. That is where you have your transverse sinus. Okay. Then here you have your tentorial notch, this, and you can see the midbrain here passing through there to connect the forebrain and the hindbrain. Then also the other name of tentorial notch is your incisura tentori. Incisura tentori. Please remember that. That is the other name. Now let's look at the falx cerebelli, not cerebri, cerebelli. It is a low elevation of the inner layer of the inner meningeal layer along the midline of the posterior cranial fossa, usually extend from the internal occipital protuberance along the internal occipital crest to the posterior margin of the foramen foramen magnum. Okay, it usually separates between it is found between the two cerebellar hemispheres. Okay, you can see here it is. It usually extends from this is the internal occipital protuberance. Then you'll have your internal occipital crest there, and then your foramen magnum. Foramen magnum is this one here, foramen. So it extends from there here. Here it is. Okay, that is your falx cerebelli. You can see it is somehow sickle shaped. This is one cerebral hemisphere, and the other one we have cut it. Here you can see your falx cerebri, okay? And along this border here, that is where you have your inferior sagittal sinus, but here you have your superior sagittal sinus. Then here they have cut the tentorium. It cannot be seen in this view. So the diaphragmacera, it is a horizontal sheet of the inner meningeal layer that forms the roof of the pituitary fossa. Okay, so it is like it is separating the pituitary fossa from the other parts of the middle cranial fossa. So it acts like a diaphragm. No wonder the name. Now, dura of the floor of the fossa is usually prolonged up to the sides of the fossa. That is the pituitary fossa, also known as the hypophyseal fossa. Then to be attached to the middle and the posterior crinoid processes, then forming an intervening flange between the fossa and the cavernous sinus. Then from this dura, it usually extends medially to form a diaphragm, which is usually perforated by it is usually perforated at the center by the pituitary stalk, and it is continuous laterally with the roof of the cavernous sinus. Here you can see the hypophyseal fossa or the pituitary fossa is down here, but here you will have a layer of dura separating the hypophyseal fossa, and it is from the other parts of the brain. So it is known as the diaphragmacera, and it is perforated here by the, you can see being perforated here by the pituitary stalk or the infundibulum. Okay. So blood and the nervous supply. Now, the dura is usually supplied by numerous branches of the internal carotid, ascending pharyngeal, maxillary, occipital, and vertebral arteries. Now, but please note this: the middle meningeal artery is the largest of the meningeal arteries, and from a clinical point of view, it is most important, for it is often damaged in head injuries, especially if you have head injuries to the area of the terion. Okay, area of the terion is where near your temple, near your temples. Okay, that is where terion is found. Okay, and I will show you that. Then the nerve supply is mainly derived from three sources, from the three divisions of the trigeminal nerve, that is ophthalmic, maxillary, and mandibular nerves. Then from the first three cervical spinal nerves, C1 to C3, also from the cervical sympathetic trunk. Now, the supratentorial dura, that the dura which is found superior to the tentorium cerebelli, is supplied by the meningeal branches from the three divisions of the trigeminal nerve, with the meninges in the anterior cranial fossa by the meningeal branches from the anterior and posterior ethmoidal nerves, which are branches from the ophthalmic nerve. Okay, yes, and the middle, the meninges in the middle cranial fossa by the meningeal branches from the maxillary and mandibular nerves. Then the infratentorial dura, the dura which is found in the posterior cranial fossa below the tentorium cerebelli, is usually supplied by the ascending meningeal branches of the upper three cervical nerves. Okay, and this is important because if one has meningitis of the meninges in the posterior cranial fossa, because the ascending branches of the cervical nerves, of the upper three cervical nerves, they also supply the muscles of the neck. So there will be referred pain, and it can cause, that is why if one has meninges, we complain of a stiff neck, okay? Because of this, the ascending meningeal branches from the upper three cervical nerves, they also supply the muscles of the neck. I promised to show you, this is the middle meningeal artery, a branch from the first part of maxillary artery together with the superficial temporal artery. They are the terminal branches of the external carotid artery. Then you can see here it is bifurcating to form a posterior branch and an anterior branch. Okay, also known as the parietal branch and the frontal branch. Then you can see here this area. It is running through a tunnel. This is the area of pterion. Okay, the area of pterion there, and injuries to that area can cause damage to that blood vessel, which will cause extradural hematoma. Okay, causing the dura mater to be stripped off from the bone. Okay, so that is about the blood supply. But you can also see we have like the mastoid branch of occipital artery, which supply mainly the dura of the posterior cranial fossa. You can also see the branches from vertebral artery. Okay, you can also see meningeal branches from anterior ethmoidal artery. Okay, so please go and revise this. And I think I've come to the end, and thank you for your attention. And please subscribe to my YouTube channel for some more content like this. Thank you.